get a better sense of all the pieces that are involved and the timelines and the details and what exactly needs to be done. So thank you very much, because that's really, really key to making this a successful project. With that, I'd like to get started. Can we get the next slide, please?
Good morning, everyone. Sean Sonata with the Oahu region here. So for those of you who have fully read Act 212, this whole committee is created, or this whole working group is created through Section 9 of Act 212. And in that act, it does create what's called a working group, which is a smaller, I guess, consensus of people, whereas there's the consultative working group, which is the small group and this group at large. Because of the confusion in the language of the statute where it says working group and consultative working group, we decided to call the small working group a steering committee. So in order to effectuate what we need to do as the members of the steering committee, we do have to proceed with a motion just as a formality. So the working group members are comprised, well, the decision is actually a little bit more complicated than that. There's the working group members and the decision-making working group members. So the ones that are making the decision here by statute would be Dr. Char, Derek Akiyoshi, myself, and Marian Tsuji from the Department of Health. But the larger part of the steering committee working group would be also comprised of Heather Ching Manzano, Janice Morita, Steve Sakamoto, and Mike Kamamoto. Mike is with the Oahu region. The other three are with the Department of Health. So that being said, this would just be a vote for the working group members in addition to the steering committee members. Hope I didn't confuse anyone, but here it goes. I move for the establishment of the steering committee to be comprised of the Director of Health, the Deputy Director of Health for Behavioral Health, the HHSC Oahu Region Chief Executive Officer, and the HHSC Oahu Region Chief Administrative Officer. Pursuant to Section 9B of Act 212, 2021 Hawaii Session Laws, the steering committee members are authorized to investigate transfer activities to be implemented by the working group by making decisions, assisting the Director of Health and Chair of the Oahu Regional System Board or designee to make final decisions, establishing and directing priorities for the working group, and eliminating obstructions on working group matters. The steering committee shall report its findings, decisions, approvals, priorities, and obstructions at the next duly noticed board meeting or working group meeting. Based on this motion, do I have a second from the working group? And please unmute yourselves before you speak.
I'll second it.
Okay. All in favor, say aye.
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 Aye. Aye.
Okay, for the record, I heard 7 ayes and I'm eyeing as well. So that would be 8. The measure or motion passes. Okay, now that that logistical matter is taken care of, we can move on. Thanks, everyone.
All right, this is Brandy Cannon, and I'll be helping facilitate this meeting today. The next topic on our agenda is project status updates. And so first up, we'll have the finance, accounting, and facilities workstream presentation, and the presenter will be Todd Okamoto. Todd?
There it is. Good morning. I'm Todd Okamoto. I work with RGP. I think I introduced myself at the last meeting. My focus today will be on the finance, accounting, and facilities, as Brandy just mentioned. I guess to preface all this, it's this area is sensitive to everything else that's going on. IT, you could argue as well. Financially, though, there are a lot of moving parts. And with that, I will get into what we have accomplished so far. Assessing that the interconnectedness of everything and the financials, I have had recurring meetings with the Department of Health and HHSC Oahu region. I did get in touch with corporate as well. We've gotten 5 years of the historical financials to get a sense of the current trajectory, which is kind of hard to gauge with the whole COVID thing going on and any other disruptions that may have taken place during the time period. The fixed asset register as part of assessing what the organization has on hand to work with going into a carve-out situation was also very helpful to get with the register. Other indicators of activity going on with the patient days, we received that, as well as some discussions and guidance on whether or not we need a certificate of need from the Department of Health Healthcare Assurance. Facilities management, we've also had meetings with the Workstream leads to get an idea of what that whole transition will entail. I'll kind of skim over these tasks to be completed. A lot of them are going to be covered in the timeline, the fixed asset inventory valuation, the budgets, capital lease accounting, which is unique to government at this point, payer contracts, which will be in the revenue cycle area, as well as Medicaid. And again, the IT system has found its way into our finance and accounting with the point-click care, which is the medical record system that is currently being used, and moving that to Department of Health, which could get a little tricky. On top of that, the high-level estimates are in progress, but I'll talk about that more on the next slide. Next slide. Okay, so now I need to first just say straightforward with the digging into a lot of the workings of this. The timeline that we're looking at is really what can be done if we stick to a very strict framework and there are no deviations. Everything goes to plan, which is optimistic. I would say that with things like the financials and coming up with a budget, that is that can create a lot of complexities. So please take this with a grain of salt, if you will. So far, I'll get into the areas of this timeline. With the budget and finance, we will need, according and in accordance with the language of Act 212, a budget, 5-year operating and 10-year capital by next month. And that is for the governor's approval eventually. In order to come up with a comprehensive budget, we'll need to do a full assessment of everything that's going on. So far, we're getting an idea of how things are operating, but over the next year, we would project when if everything's in place, our budget to be created by next September, ready for the biennium budgeting approval process in October, November. Going to accounting now, as I mentioned earlier, there's a change in accounting standards, which requires us to go through all of the leases that are currently being held by HHSC Oahu region to determine changes in accounting that might affect valuations and whatnot. Fixed asset inventory and valuation, that will require us to physically go around and identify everything that is on both on HHSC's books and not on HHSC's books, and bring everything into protocol with the state of Hawaii. So reconciling all of the things that they would consider inventory things to be kept on record on the balance sheet, if you will, versus things that are either there or not. Point-click care, interestingly, this is the first EMR system that I've seen with a GL system, an accounts payable system on it. Migrating that to whatever the Department of Health standard is another cumbersome undertaking, as I've experienced with making sure that all your vendors are lined up, all the vendors can be paid timely, and that all the information is accurate to both the satisfaction of the Department of Health and the operations at HHSC Oahu region, so that payments to vendors are not disrupted. On the revenue income side, the cash in, this is also something that is pretty tricky with a lot of the caveats with the whole payment systems in healthcare, I would say collectively. RCM on revenue cycle, that means revenue cycle management. So the transition of all of that, those processes from point-click care and corporate HHSC, those need to be properly transitioned over to the state so that the cash incoming is not disrupted. Those and other revenue cycle processes we would expect in a undisrupted scenario to be possibly completed by December. That is extremely important for purposes of keeping operations going and cash flowing, the cash coming in to remain sustainable and in an acceptable shape for our vendors, and make sure that that payroll is taken care of. As far as the facilities management, A&E is a firm that has been contracted to help with the current estimates for bringing the facility up to code and to look at potential projects. That again would be heavily driven by whatever is accepted as the budget. There are a few other areas like the Maluhia facilities maintenance repair and other negotiations that need to take place, legal transfers of the facilities in order for us to move forward. With that, I will pass it back to Brandy.
Thank you, Todd. All right. Our next presenter for compliance and legal is Michelle Cato. So Michelle, if you could unmute yourself and then take 2 to 3 minutes to kind of walk through the update on compliance and the major transition steps.
Morning, everybody. My name is Michelle Cato. I'm the Compliance and Risk Officer at Oahu region. So this morning, we're going to go over the compliance this timeline with you. So far, I met with RGP. We had 3 meetings to discuss the compliance transition. So the work that was accomplished, we identified the transition timeline and support. We obtained the program descriptions and policies. We met with the compliance officer, Carol, HHSC Corporate Compliance Officer, Carol, and the Department of Health EEO Officer, Will. We requested for Department of Health compliance contacts. So the tasks that need to be completed is we need to meet with the Department of Health Compliance Officer, DIGS Risk Management, determine the transition timeline and support requirements. We need to obtain the Department of Health Compliance Program requirements and map it to the HHSC compliance program. We need to obtain Department of Health contacts and other departments that perform activities currently performed by HHSC compliance program. And last, we need to refine the high-level timeline and estimates for the transition costs and post-transition support. So on the bottom, you can see our transition timeline. There are 7 items. So the first is just we need the legislative approval of the transition. Then we need to map the HHSC compliance program to the Department of Health compliance requirement. So we estimate about 3 months for that. And any open compliance issues, we need to remediate that, and that's just ongoing. The transition for compliance issues from HHSC, the system, to Department of Health, we estimate about 3 months for that. The compliance work plan, the remaining 2 months of the year, and then transitioning the risk management insurance responsibilities first quarter of 2023, and then educate and train employees on the new compliance program will be the last month of the year, and then throughout the year in 2023. Is there any questions?
Thank you, Michelle. We appreciate that update. If we, and just a reminder, if anyone has questions, we'll take questions at the end, and you can put your questions in the chat. All right. Our next work stream is human resources and unions, and we'll have Heather Ching Manzano as the presenter. So Heather, if you can unmute yourself, this slide is ready for you.
Hi, everyone. My name is Heather Ching Manzano, and I'm the Department of Health Human Resources Office Representative. So far for human resources, the work that's been accomplished, we've held a planning meeting between the Department of Health and HHSC leadership on HR integration. We developed a high-level timeline. The HHSC has provided the DOH with a list of job titles or charge job descriptions and class specifications. We've also had a meeting with Andrew Garrett, the Deputy Director of the Human Resources Development, Department of Human Resources Development. We've submitted a request to the HHSC for all personal data to be sent to the DOH and Department of Human Resources Development for impacted employees. With that, the tasks that still need to be completed, we need to be informed of the decision about what the future organizational structure will look like. The DOH needs to analyze all the personnel data received from HHSC to prepare to start the implementation of the major transition steps outlined in the timeline below. And HHSC needs to send information regarding volume of workers' compensation claims to the Department of Human Resources Development to enable development of high-level estimates on the transition costs and post-transition support. We've identified these major transition steps below for the timeline it'll take to transition all the employees over to the Department of Health. First off is the legislature approval on the transition approach and funding. Then the transitioning of employees, classification analysis and mapping. We've estimated about 3 months for that. We need to create new classifications as well as approval within the Department of Health. Personnel issues, resolution and transitions, both estimated at about 8-month timeline. We have to resolve open issues with pay and benefits, enter transitioning employees into our systems, as well as educate and train the new employees, all of which we've estimated to go into 2023.
Great, thank you, Heather, for that update. And next I'll invite the UPW and the HGEA representatives, if you guys are here. If you have any comments related to the progress with the union, we've basically held initial meetings. We welcome you to make any comments at this point.
Thank you, Brandy Wesser with HGE. I just wanted to thank you guys for the clarification and the timeline of things, the consultation with the unions and things like that. So we'll be looking forward to that. Thank you.
Thank you. All right, any comments from HGEA?
Well, that was me with
Oh.
HGE. West.
Okay, sorry. Any comments from UPW?
No.
Okay, thank you. And next I'll
Brandy.
ask Sean Sonata. Yes.
Okay, yep.
There you
Thanks,
are.
Brandy. Yeah, so just to echo what Wes mentioned, both in this meeting as well as prior to this, was that we do understand that any changes that will impact the employees' working conditions, will be subject to consultation, negotiation, whatever is appropriate under the circumstances. We do intend to honor that, and we do know that based on prior conversations, if you look through the major transition steps, we do understand that the timeline is really ambitious because we do understand that we don't know right now exactly what will or may impact the employee working conditions. So as they arise, we will have to do the consultation process. So going through that process may take more time. It may add to this. And I think everyone already understands that when we look at all of these timeframes and the dates, it's all on the understanding that this is a best case scenario, assuming that there were no issues with any parties and that the staff that were working on this could really be working on this full time. We understand that that's not really the case, but the only way that we could kind of create a timeline that sort of fits within the current existing language of Act 212, making the transition actually happen end of 2022, was to kind of cram everything in here with ideal dates of completion. But the real expectation for us, if we're going to do this right and do this correctly, would be to take a more measured approach, make sure that everyone's rights are protected, and get this done solid, even if it ultimately has to take more time, better than doing a sour job in such a short crunch. So just as long as everyone's aware of that, just want to make that known. All right, thanks.
Thank you, Sean. All right. Our next work stream is IT infrastructure and systems. And I welcome Steve Sakamoto to unmute, and he will be covering this slide.
Good morning, everyone. So this is on the IT infrastructure and systems. Department of Health has held a couple meetings with HHSC to discuss some of the needs and requirements. And in our discussions, there was over 60 application areas that we need to review. So we need to look at what the current state of the systems are and where we want to go, and the ownership of these systems. And as far as estimates on the transition needs and efforts, everything is very, very preliminary, since we've only had a couple meetings. So we still need a lot more detail to be worked out. But we've identified that there needs to be, whether systems will continue to be contracted, what the data and system migration flow will be like. Also, how to go about the implementation of the systems, how much training would be required, the vehicles to be used for procurement, the costs that would be involved, and also staff time and resources to make all of this happen. And so some of the things, as I mentioned, we've done thus far is, identifying what the organizational reporting structure would look like, prioritizing the applications that will need to transition, and then develop, some of the high-level estimates regarding costs and post-transition support. Also, having HHSC do assessment on time and efforts on some of the application migrations, and then also having a detailed plan for implementation for phase 2 once everything is approved. And as far as the transition steps, the first step is having the legislature approve the approach and also the funding. And funding is critical in the IT component, because as many of you know, there's been a supply chain delay in ordering of equipment, from regular computers to printers. But some of the more sophisticated networking equipment that we may need to establish connectivity, such as routers and switches, has a significant backlog in ordering. So having the funding in place will be able to get a timely order and receiving the shipment of equipment that we need to get everything functional. Of course, we need the approval of the transition plan and priorities, and kind of coinciding with that, developing the application transition plan and also implementation. We're looking at having simultaneous work being done to move the process along. Contracting, we need to look at what each application contract is, how it's structured, and what we would need to do to move over the contract or establish a new contract. As far as migration, we need to look at data that needs to be migrated, what exactly needs to move over. Then we need to set up the new system and also do the training that would be required to have everyone be operational in the new environment. Since most of these systems are systems that they're currently using, there will be some changes in a few applications, I think, but overall, most of the systems that they will be using will be existing systems. So hopefully training would not be too much of a burden. That's the kind of report for the IT infrastructure and systems. Thank you.
Thank you, Steve. Our next work stream is clinical operations, and this will be presented by Tricia Juan and by Gonzalez.
Hello, everyone. I'm Tricia Juan. I'm the Maluhia administrator. Okay, so under the work accomplished, the administrators and the directors of nursing at each facility met with RGP regarding our clinical operations. So during our meetings, it was determined that there would be little to no changes for staffing unless we plan to add service lines. We currently use a core staffing model that was developed to cover our 24-hour staffing needs. We also don't anticipate many changes to our current clinical operations, our policies, procedures, certifications, or licensing, as many of these are based on our regulatory requirements as a skilled nursing facility to participate in the CMS Medicare and Medicaid programs. If we move to our identified required licenses, these are all of our licenses that we currently hold. So the CMS CLIA, that's our laboratory license. DEA is our license for medication, controlled substances. OHCA is the Office of Healthcare Assurance. So that's our annual recertification that allows us to continue to participate in CMS Medicare and Medicaid. Radiation is for our dental x-ray equipment at Maluhia. We have our wastewater permits. Our medical director is a licensed physician in the state of Hawaii. Pharmacists, we have a pharmacy vendor called Pharmerica, and our licensed pharmacist is through that vendor. And our nursing home administrators also need to carry licenses in the state of Hawaii. So with the exception of the radiation license, which is every other year, all of the remaining licenses are renewed annually for our facilities. If we move over to the tasks to be completed, if we identify new service lines at our facilities, we'll need to define our scope, identify our resource requirements. For example, if we take on a behavioral health population, it may require additional security systems. Bariatric or ventilator type patients would require equipment, training, infrastructure changes. We would also need to identify additional licensing requirements and develop our financial projections. We're already going to begin to transition our existing policies and procedures, but if we establish new lines of service, then new policies and procedures would need to be developed for each new line of service. And the last bullet there on food service certification, that actually belongs on the left side under the identified required licenses. So both of our kitchens are considered high-risk institutional kitchens, and the Department of Health visits annually to recertify them. For the major transition steps, the timeline there, it's straightforward, self-explanatory, so I won't go into detail unless there are any questions. That's all I have. Thank you.
Thank you, Tricia. All right. And next we have vendor transition and contacting work streams update, and we have Scott Kawai as the presenter. Welcome you to unmute yourself.
Hi, my name is Scott Kawai, and I manage Oahu Region's contracts. So Oahu Region has discussed with corporate DOH and RGP regarding our contracts transfer. There are approximately 200 regional and corporate vendor contracts that Oahu Region is currently participating in. So for the Oahu Region issued contracts, as far as work accomplished, we've currently identified and compiled the key information points such as vendor name, description of services, contract end dates, termination provisions, method of solicitation. And these will all kind of assist us in the transition for the services under DOH. So we've also, DOH has provided an overview for the transfer process subject to 103D and 103F procurement rules for vendor services. This is applicable because Oahu region is currently exempt from 103D and 103F. So there's going to have a transition of procurement as well as the services and contracts. HHSC has provided vendor spend information. HHSC legal team is currently reviewing and working with Vizient in regards to our GPO membership or Oahu region's GPO membership and contracts that Oahu region is currently participating in. So Vizient is our main primary GPO for medical supplies and equipment, including many housekeeping and maintenance products and service or equipment. So that's one of our main GPOs that we use both as a region and as all the regions. So we're trying to ideally maintain usership of it. To move on to tasks to be completed, we need to further gather and compile information on HHSC corporate contracts. So we need to compile vendors, services, termination provisions, method of solicitation, as well as Oahu region's usage of the contracts and effects and/or penalties to other regions with Oahu region's withdrawal. We need to develop high-level cost estimates for the transition of contracts and agreements and post-transition support. This may include staffing costs for solicitation and procurement of these approximately 200 contracts. There may be reduced GPO savings for Oahu region and the other regions based upon our termination or withdrawal from GPOs. There may be termination fees for various contracts, etc. We also have to develop options for Oahu region to ideally have access to the Vizient GPO. This may be having Oahu region, maybe having Oahu region's purchasing power included in the GPO agreement and HHSC invoicing DOH for usage, or some type of innovation or innovative creation of the or revision of the current contract. But this needs to be further investigated. We need to develop a separation or transfer terms for majority of the HHSC corporate contracts or possible continuation of access where applicable, such as Vizient. We'll also have to coordinate with DOH on any redundant services that DOH currently already has. This may include like legal services or compliance services, IT services. These are all, as far as the other slides go, there needs to be coordination because Oahu region currently has contracts for all of these, and we need to kind of determine what is redundant and what needs to be transferred over. We need to identify any changes resulting from Oahu region's removal from the various corporate contracts, and as I discussed previously. So as far as the major transition steps, for the beginning of 2022, we're gonna continue reviewing the 200 contracts, approximately 200 contracts, to determine which contracts need to be transitioned or replaced or terminated. And once we've completely identified those, or concurrently, we will be needing to actually transition these contracts. So as far as the second for the Oahu region, as far as the second line item for the Oahu region and corporate contracts that need to be transitioned, complete contracting process, this needs to run, or this ideally would run into the, I'm sorry, I thought we revised this slide, but we approximated that the transition of or complete contracting process would be ideally completed in the first quarter of 2023. And for the third line item, for the Oahu region and corporate contracts that can't be transitioned, complete solicitation and contracting process, pending allowability of transferring contracts to DOH. This will most likely run into the third quarter of 2023. So this slide should have been revised, but there needs to be extra time for soliciting any contracts that need to be resolicited for DOH, because DOH and Oahu region have different procurement rules and regulations. So this has to be kind of worked out as far as how we're going to transition services without any loss of service, but the procurement methods are actually different. So yeah, we need to, yeah, but in any case, that's our projected timeline.
Thank you, Scott. Thank you for the update. And next we'll have a review of the best case scenario timeline for the transition to DOH by Mikhail Gorbentenko, RGP.
Good morning, everybody, and thank you, Brandy. What we've done on this slide, we put together a summary of work streams, projected timelines, and so it will be a one pictorial representation of what we are looking for. Allow me explain what you are seeing in the picture. So in the end of 2021, which is where we are at right now, November, December, our focus as a team is to, we'll spend the remaining month and a half working on updating or timelines, making it more realistic as we discover more information through our work efforts. On top of that, one of the big key accomplishments will be we start working on developing the cost estimates, how much it may take to accomplish the transition. And if you think about cost estimates, they typically fall into two categories. One would be the cost of the transition. So if our work stream will require other additional resources, be it people, consultants, subject matter experts in a particular area, or is there a cost associated with paying vendors like IT vendors or revenue cycle vendors to update their system to accommodate for new entity, legal entity, and all new potential NPIs and other numbers for billing purposes and collection purposes. So that is, we will do our best to estimate the transition cost, which is people and the potential vendor cost. After our transition is completed, we will work on estimating any additional cost it may be associated with continuing operations, and if areas in the Department of Health, like human resources, compliance, or legal or other, will require adding resources, people, or contractors to continue support operations of Oahu region as HHSC corporate will disengage. Once we put those estimates together on the scope, timelines, and the cost, we will provide it to the steering committee and the working group. And those, our findings and the final report out will go to the governor and legislature. And the legislature meet early next year in January, all the way through May. We expect sometime during that, during those meetings, probably closer to the end, there'll be decision made on the type of a transition and potential funding associated to support this transition. Once a decision is made, it will be a kind of a green light to start each work stream or teams to continue provide better planning and start executing transition activities. And what you see in the blue bar graphs, those are the, as everybody mentioned, our best case scenario of understanding what would it take to complete all the tasks or major milestones our work stream leaders walked you through just a few minutes ago. We also understand that most of all of those individuals have day-to-day responsibilities or day jobs, and to add transition activities, it will be an additional ask of those teams, of those departments, and will require either reprioritization or some kind of additional changes, adding resources to complete or execute those tasks. We also believe, you can see in the end, those yellow extensions, named likely extension due to resource constraint. What we as an RGP team estimate, based on our experience in the transition, likelihood of those best case scenario to be extended beyond projected timelines into the future, based on the complexity and amount of work that needs to be completed. In the meantime, as you can see, we are looking into 2024, potential 2025, to complete transition based on all the tasks have been outlined in the prior slides. So what we are looking at, key considerations for immediate future, we have one is we still need to have a decision on the legal entity for Oahu region, and our teams are consider multiple options at this point. We need to understand the cost and the timelines better, and our focus for the next few months to fine-tune those estimates and submit them for approval. And also, we believe that transitioning by 2022, as required by our regional legislature, is very much unrealistic and creates a lot of risk for service interruptions or impacting other employees or patients if we rush into that transition. So we would most likely will have to work with the legislature and ask for an extension to execute our transition thoughtfully and incorporate and minimize the risk of the disruption to the patients and employees. Brandy?
All right, thank you, Mikhail. Our next topic is next steps. And so there's three main next steps that we'll be focusing on. The first is updating all of the timelines for every work stream and really narrowing down the scope of what activities and responsibilities will be transitioned. As Mikhail mentioned, completing the second thing is completing the cost estimate for what it will take to do the transition. And then the third activity would be completing the 5-year operating budget and 10-year capital operating budget. And this is just a reminder that the transcript for this meeting will be posted on the State of Hawaii Department of Health website. And
Brandy,
next,
sorry, Brandy, can you go back 2 slides to Mikhail's slide?
Sure.
Yeah, I just want to clarify one thing so that there's no confusion. If you look at the first yellow box in the beginning of 2022, just want everyone to keep in mind that this isn't the only thing that's going on. The planning and transition overlaps. I mean, the planning transition begins now, and we're going to be working on everything. I'm sure all of you are aware of this because we have been working very diligently on getting this, put together and developing the plan and execution. So the part about legislative decision making is only occupying this amount of space just to show that that's the session where no final decisions are made until May. But during that interim period, that's not the only thing that's going on. I mean, we're all going to be collectively working on this and making this happen. So just to clarify, so there's no confusion. Okay, thanks, Brandy.
Thanks, Sean. Mikhail, did you have any comments?
No, I want to just thank you, Sean, for making that clarification and make sure it's clear that we are not waiting on anything and the work will continue.
Thank you, guys. All right. And now we are going to, I'm going to stop sharing and we're going to open up a question and answer session. And so what we'll ask is for everyone to please type your questions in the chat box if you have them. And as we see questions come up, we will direct them to the right party.
In the meantime, I just want to echo what Dr. Char started with at the beginning of this meeting. You know, all of you are putting in a lot of effort, a lot of time into making this happen. And please know that we truly appreciate, you know, all of your assistance. There's no way we're going to get through this and accomplish this without your help. So, you know, from all the department heads to department staff to HGA, UPW, you know, all of you guys being a part of this is super important. And we also want to thank our consultant because without you guys, the coordination of this massive endeavor, you know, would be nearly impossible. So thank you as well. I see a question.
Thank you, Sean. Yes, and we have a comment from Dr. Libby Char, and she's asking for clarification that some things will have to be done in a series or sequentially, and it will be dependent on other work group accomplishments and activities. So, Mikhail?
Yes, absolutely. And Dr. Char, you're absolutely correct. Most of the tasks can be happening together, and we don't have to wait for one task to complete before we start another. But as we work through our timelines and estimates on what needs to be done, we identify risk and dependencies. For example, if contracting is required, and it's a first step in the IT transition process, then the task has to wait until contracting is completed before we can start executing a migration. Or if purchasing is required of a new equipment before we can execute migration, it will be completed. Also in the facilities, for example, we have to complete an assessment and count inventory before certain tasks can begin. So it's kind of a combination of both, but there's huge dependencies between different work streams on each other. And we are working in identifying and capturing all those dependencies. So as we're working on a more detailed project plan for the execution, it will be all in there.
Thank you. Yeah, I appreciate all the work that has gone into this and kind of reiterating what everybody said thus far. We needed to draw out a timeline so that we have someplace to begin and we can kind of get some realistic estimates. But there's a complexity here that I just want to make sure we all are recognizing that some pieces are dependent on other pieces. And so, you know, we're not going to be able to really embark or accomplish a task until the prior task has been done. So that may kind of mess up our timeline a little bit, but, you know, we had to come up with a timeline to start somewhere. So it just thank you for the work and the effort that went into creating a timeline, and just acknowledgement that it will be, that's our best guess estimate, and that it will be fluid, and we'll just have to take things as they come. And to Sean's point, you know, we want to make sure that the final product is something that's very workable and it's reasonable and it's a high quality product, rather than just trying to rush to get through this timeline. Thanks.
Right. The next thing on our agenda is to provide the date for the next public meeting. So that is scheduled for December 15th, 2021, and that's a Wednesday. And our final agenda topic is the adjournment of the meeting. And so I'll hand it back to Sean Sonata.
Okay, well, thank you everyone for participating. I think we all know that we have our plates full, and we're going to have our plates full for the next, I can't even put a exact timeline on it. I mean, we've been so focused on how long this will actually take to get it done correctly that, it's kind of ambiguous right now. We can just put our best foot forward and, be open and transparent with each other, as well as with the legislature, as to what it's going to take. We all want to get this done, get it done right. So thank you for participating yet again. I'm going to let Dr. Char give the final comment. Seems like she has something to say. So on that, I'll sign off. Thanks, everyone.
Thanks. No, what we've been saying, really thank you for the time and the effort that everybody's put into this and all the meetings and trying to find documents and outline everything. We really, really appreciate it. There's no way we're going to pull this off without everybody pitching in. So thank you for doing that. And especially thank you to RGP for, really doing some pretty comprehensive work and being meticulous in the process. We really appreciate what you've done. So thanks for the help. And as noted, we're already working on this. We'll continue to work on this. Even though we can't finalize certain things, we are already in progress. So thanks everybody for your efforts.
Thank you. And from RGP perspective, we wanted to thank all the collaborations and the responsiveness for all the workstream leaders and the members, and look forward to continue our productive work.
See y'all on December 15th.
The meeting is adjourned.
Thank you.